to the program. It is Wednesday, and that time to visit with one of our favorite people. Yes, indeed, ladies and gentlemen, Dr. Steffany Mohan from Plaza Dental is here because it is time to give everybody a great smile. Oh, isn't that nice? Now, we are here to talk about something that a lot of people still to this day a little frightened of you guys.
I know, I know. We're not.
You're so intimidating.
Yeah, we know.
But it's really, really important to go see you on a regular basis.
It is. So today we're going to talk about kind of the value of that, right? So what's it really worth? I mean, because I have a lot of patients that they come in and they've taken a break, which I understand. Life happens. And then what they find out is that they really wish they'd valued their teeth and their dental health and everything a lot more. And for so many reasons, I mean, for aesthetics, for their smile, for their function and chewing, and it's really frustrating for people when they can't eat whatever they want to eat. I mean, right. We all go home and we take for granted that we can literally, if we want to eat it, we can.
Right.
And a lot of people really struggle to do that. They can't eat steak, they can't eat corn on the cob, they can't eat popcorn, they can't taste their food because they have an appliance or something in that goes over the roof of their mouth, so it's very difficult to taste then. So we kind of take a lot of those things for granted. And so what I like to tell people when they're younger is that you probably have a gift of up to like $100,000 in your mouth. I mean, because truly people spend so much to restore what they're missing or what they've lost. Over time. And so, I mean, like, we have people that come in, and if you grind your teeth down to nothing and you have to build everything back up to where, you have all of your teeth functioning again, it can be $50,000 or $60,000, which isn't very common. A lot of people don't have that to invest in their teeth, but just remember that's what you have to start out with. So, I mean, it's a really, really nice car. And so go buy the really nice car instead of put it in your teeth, I mean, I would rather have people do that. I really would.
And it's something that's easy to take care of, like,
it is.
By basically just brushing and getting visits.
One of the best things, you don't get a whole lot of feedback information from brushing your teeth, but you get a lot of information from flossing. A lot of information from flossing. I mean, so you can tell if there are spaces that weren't there before. You can tell if there's bleeding. You can tell if there's, I mean, if there's food getting caught someplace. Food getting caught in a space causes a cavity a lot of times. So I mean, there's a lot of things that really we should be aware of that we're not. I mean, that we're not quite as much. So. And
now flossing has become such a breeze with those little contraptions you can buy. Those
or water pick is kind of equivalent to flossing. I mean, a lot of people. We talked about shower floss one time on the show, and just hook it up to your shower and use it in the shower. So there's a lot of really easy ways to do it, but yeah, it takes a little bit of daily maintenance. So.
And as you said, the technology of dentistry has moved along, so there's different toothbrushes out there that can help you out, floss, things like that. Where has dentistry as a whole moved so that people don't have to be so frightened if they have that fear of going to the dentist?
There's so many options and there's so many great things out there. I mean, there's basic dentistry and then there's sedation dentistry. You can literally sleep during an appointment. I mean, and
if you're that frightened,
you could wake up and not know what happened. There's lots of witnesses, so you don't have to worry about creepy things happening.
There's cameras.
Right? Yeah. Exactly. But then there's implants to replace teeth when people lose a tooth. I mean, very rarely do people get to we're talking about your dad that was 81, get to the end of a lifespan without losing any teeth. So
that's what his big concern is now. They said they're talking about having a temporary bridge. He says he doesn't want anything to do with that. He wants one.
And most people don't want something that takes in and out. Right. Most people don't want anything to do with that.
You're still able to do that at that age. You can still do that.
Absolutely.
Oh, yeah.
Good. Definitely. My oldest implant patient was 92.
Wonderful.
So,
seriously?
Yeah, she was fantastic.
Isn't there evidence now that
and lots of 80-somethings, lots of them.
That gum disease and plaque can affect things like the heart and other areas of your body as well if you don't take care of your teeth.
Well, that's the other thing too, is overall health. We used to think that the mouth and the body were not connected. Somehow. I mean, of course we knew that they were connected, but we didn't think that the systems were, interacting with one another and causing other things, and of course they are. So yeah, there's tons of evidence. There's, tons of research that's been done about that. So.
Yeah. Well, I brush my teeth every time you come on the show.
Good.
So maybe it's whether you need it or not.
Every couple of weeks, he's good to go. Yeah.
So you might want to come in a little more often.
Yeah, exactly.
But there's things you can do, and there's advances, as we said, as simple as maybe your favorite music playing in the background, so you're not concentrating on the
Well, I
noises
tell people, take your floss in, put it on your bedside, and floss when you're watching a show or something. I mean, you don't have to be in the bathroom to floss or to do something like that. I mean, my husband and I, do you want your teeth toothbrush? Yeah, and you know, bring it into the bedroom so he can. I mean, it's silly things like that, but I mean, you know, just have a system so you can do it, you know, a couple times a day. And
do you know when the last time I flossed?
I don't think you want to.
Just now?
In between commercials. Yeah. In between commercials, and I'm not lying. Galen was here with the pork steak.
Right.
You know, so
nice.
you carry these around. These things really
those are fabulous.
Now, have you thought of, this is a $1 million idea,
right.
Jason? Ready for this one? Okay.
Finally.
Get one of these little contraptions here. Plaza Dental right on the side there.
Yeah, we really should.
Yeah, you should. Okay, you're welcome.
Yeah. Okay, thank you.
Top of mind. Top of mind. Gotta keep that.
No, but they are great, and that really is important. And you hit the nail on the head.
Right.
It tells a lot about your mouth health.
It does, absolutely. And you know, I mean, you know, nobody wants their heart to give out, but it would be silly to have it. The other thing that's really strange about dentistry is that many things that happen, you know, a cavity doesn't hurt until it gets really big. Periodontal disease that destroys the bone around the teeth, it doesn't hurt really ever. I mean, your gums will bleed and you'll have signs and that kind of thing. That's why flossing is important, because you'll actually find out what's going on. But there are a lot of things that happen that we really can't tell. And truly, you know, I mean, I know there are people that think, well, the dentist is just trying to get your money. We want you to keep your teeth for your lifespan,
right.
Because otherwise, I mean, I see people all the time that are they're depressed because they don't have their teeth, and nobody wants to wear dentures. They're big and clunky and bulky, and you don't want to wear something giant in your mouth.
Well, let's say you have relatively good teeth. How many times would you say is normal to go see a dentist?
Twice a year.
Twice a year is all you would need.
Yeah. Twice. I mean, we go to the mall, we go to the, you know, we do all sorts of things more than twice a year. So, you know, I mean, once a year is better than none. So,
right.
and you know, and if it's scary, like we said, we always say this: find somebody else. You know, if somebody scares you or something really, you know, makes you nervous, even if it's my office that scares you. I mean, like, go someplace else. Go enjoy your experience. It should be kind of a nice experience, really.
Well, we highly recommend checking out Plaza Dental. The ladies are fantastic. They play your favorite kind of music. They'll even do a little, you know, massage.
Yeah, they've got that hand wax stuff. Yeah.
You know, they truly make it an experience and not one that you're going to regret, and you'll go away with a great smile as well. So dmsmiles.com for more details, of course, if they want to find you over in West Des Moines, and the phone number to get in touch with you.
Yeah, well, it's 612-7148, or yeah, just call us.
Wonderful.
Very good. Yes,
so much.
thank
Thanks
you.
for being here. It is 9:21. We'll be back. This is Great Day live in Des Moines.